Hi, how are you?
Hi, good morning, ma'am. I'm doing well, thank you. How are you?
Lovely to have a conversation with you today, Dr. Nav.
Thank you so much. Like, it's my pleasure to be honest. I've heard a lot about you, so I was pretty excited to just meet you and know you. So, like, the work that you have been doing, so like, it's a kind of inspiration for all of us. So, it's my honor, ma'am, to be honest, just to talk to you.
Oh, well, shall we start?
Sure,
Are
ma'am.
you ready?
Yes,
Yeah?
ma'am.
Yeah, tell us about yourself.
Like my name is Navkaran. Like people just fondly call me as Dr. Nav because it's easy to pronounce as well. So I'm based in India. Like I'm from a city called Chandigarh, which is around 200 miles from the capital, New Delhi. And I've been working and practicing the medicine for the past 12 years. So my dealing was more with the like a general physician, but in the past few years, especially associated with treated, I've been dealing with female issues a lot more. And that's why like we are here to discuss more about the menopause.
Being Indian and growing up, this wasn't a topic that we openly spoke about. It wasn't a conversation that, growing up as a child, I could have openly with my mum because there was a whole taboo around the subject. Is it openly spoke about in India?
Yeah, regarding the menopause, people know about the term. To be honest, ma'am, like they know, okay, what does menopause means, but they don't know what are the symptoms it entails, like how the woman suffers, like especially in their silence. Like I've seen my mom as well. Like she knows, okay, this is the thing, but she was not aware. Like I made her aware about that because some of time we have like physical symptoms, like that could be okay, you have mood swings, you have like vaginal dryness or something like that. That issues that you could relate to, but people are still not aware. It's not about those symptoms, they are more like concerning symptoms as well, because you become more prone to cardio issues, like cardio health issues. Your heart is more
Mm.
susceptible to coronary artery disease. You become prone to fractures as well because the calcium in your bone decreases, and you also become prone to like urinary infections. Like many people, or especially women, come to me, like it happened with my mom as well. She was having repeated urinary tract infections, and she was not knowing. She said, I maintain a good hygiene, I don't go outside, I'm always at home, why am I having that? So these are some of the causes, and I think so it's still not openly talked about, but I think so we are making a progress, and hopefully in the future.
But do you feel this topic is openly spoke, within families now as well? Do you think it's getting better or?
I could say the progress is there, but to be honest, not that much. Like in India, also there is a kind of a demographic differences between the family. People who live in more metropolitan areas like Taiwan cities, they know much more about that. And if we see like India, especially 65% of the population is still rural. Like especially in those families, you can't even speak about that. And even if you just talk about that, sometimes even the woman is not aware like what's happening to their body. They don't understand like menopause means your hormones are decreasing. They are not aware. They just means okay, they can't conceive now, but they don't know like much more is associated with it.
It's lack of resources, isn't it? Which must be so difficult because if you haven't got someone to talk to openly, or there is no workshops around that you
Right.
can attend to and get that help, then it's hard. Also, I think, within the family, like I only have sons, I have no daughters. So I've made it a point to openly speak about this with my sons so that, future down the line, maybe with their girlfriends or wives, they will have an understanding.
Especially if I speak of my family, all are men here, and my mom is there. But the thing is, the we are grateful. Like I am from the medical field, so I know about that. So that's why I can relate
Yeah.
to that. I can empathize with my mom, but still people are not aware of that. So I think so more needs to be done, especially menopause in India. It's not a topic that has been discussed so far. Like we talked about like menstrual cycles and everything, but still like especially the women after 40, they suffer a lot. So we need to talk more about that, but I think so we are progressing.
And since you've been practicing, have you seen any trends in women like seeking treatment for it? Like, have you noticed that?
Yes, there has been improvement. Like women are more aware of that. Like, for example, they come to me, like, especially, okay, doctor, I have been experiencing these symptoms. Could it be related to menopause because my periods stopped like 1 year and so? But still, I'm talking about the women who are aware, who can like have more access to the information technology. But some women they are not aware, and moreover, like especially Indian women, to be honest, they're very selfless. Like as you can understand, they don't care much about them, they care about their family. Even if they're experiencing symptoms, they just don't go out. They say no, no, it's something like that, okay, I will just like it will just wean off. But still then they don't reach out, so we have to encourage them. No, no, it's associated with something that's
Really.
physiological, hormone related. Please come out, please talk to us, and we are there to help you.
And do you hear about a lot of women that don't seek help from the doctor? Like, is there a lot of women that just won't come at all to get any help? Um, and do and they do try just to cope with the symptoms. So how do you as a doctor encourage them to come more, to come and see you?
Yes, the thing is, yeah, I completely agree with that. Like women, mostly if I tell them, okay, these might be related with the menopause, they just feel like, okay, it's mostly like symptoms like this one. Okay, I might be having mood swings, I might have this like fatigue and all. But then I mostly talk to them. It's not about these. Like some of the two essential hormones that your body was producing, it has decreased in the production. So it will affect your heart, it will affect your bones, and it will affect your like lifestyle as well. If you're more prone to infection like urinary infections, it becomes really hard for you to get treated every time, and then it has a kind of a drain on your body itself. So we need to work on that. And also I also encourage them, if you can just add some kind of lifestyle things with you, increase your calcium intake, do some physical activity, because these things also help.
Do you find like in India, is there like women in different parts of India that handle the menopause differently?
Yes, to be honest, the thing is, I have worked both in the rural sector and also the urban sector. Urban sector, like in telemedicine, women are much more aware. Okay, they know, they have access to Google, they can search for it. Okay, what menopause symptoms are associated with it. But rural women,
Yeah.
they are not aware of that. Like they are completely clueless what's happening, and they just like see, okay, let's live with it. It's no common, but they don't understand that. So we have
So
to break that
what you
barrier.
say, yeah, so what you're saying then, there is a real split
Yes.
between, the woman that's got the access and has the availability to the internet to get the research, and then, the rural woman that just has to deal with it. That must be so hard. And how do you change that?
Yes, that's the prime reason they don't have access to the workshops, like especially our government. Like as you know, India, they deal with more of the other health issues. This is something which is being ignored, especially in the rural sector as well. The doctors are not that trained. They are not aware like what to do in such cases. They are more about like, okay, emergency dealing with that. And even the women are not aware of that. So we could do like something that we are doing now, like spreading awareness, like with the menopause. Other thing could be like introduction of like movies. Like we had the movies about like menstrual cycle, hygiene, how to keep it. We can
Mm.
also talk about how women suffer in this silence. Like in India is the fandom of like movies, so everyone is after movies. So we can use those kind of media, like in order to encourage like men how they can help their partners, and also to women just to come out and seek help because you need it.
And I also wanted to ask you, so the menopause in India, women that are actually going through it, do you think what are the treatment options for the women that are actually going through the menopause? Is it very similar to other countries? That
Yes, that's very right. That's a good question. Like, as we discussed, like menopause means hormones are not producing like estrogens and progesterone.
Yeah.
So we need to replace that, and that's the therapy. We go with the tablets, we go with the patches, we can also go with like injections as well. But in India, to be honest, like when as a treated, we search for it, not many treatments are available. And also in treatments if are available, they're very costly. Like if we ask a woman like who having a monthly household income of 30 to 40,000 Indian rupees, they can't afford a kind of a tablets or the therapy which includes like 5,000 to 6,000 rupees. So I think so we need to come move forward with it, and also encourage other like fraternity, like medical fraternity, and also the government just to help it, because this is something our population deals with it, especially many population and many women are above the age of 40. So we need to help them out with these treatment options as well.
Yeah, because it's so important. Because if they couldn't afford it,
Exactly.
and then they have to go, because I feel the menopause if you can't manage your symptoms, it really can be it's so hard to deal with, so if they don't even have the availability to get this treatment, how do these women cope? They just have to deal with it. Even in Western countries, like we have the HRT patches, we have the tablets, we have the gels, the creams, we have the pessaries that you can use. But I've also found, even in the UK, it's so hard to get hold of. I wear the patch. I use the HRT patches, and sometimes I can't get them from the pharmacy. There's always a shortage. I mean, is that same in India, or
Yes,
do you get shortage of treatments, or is everything available and it's just a question of people that can afford it, and in the rural areas they can't? It's not available.
That's a concern as well, especially with the availability as well. Like some people can afford it, but not many treatment options are available. Like sometimes they are mostly treatment that we found is like in the form of tablets, but tablets is very hard because you have to remind yourself, okay, I have to take a tablet.
Oh yeah.
Patches, it becomes easy, but still patches are not available. Pessaries are not available in India, so we need to work on that as well. So a lot of treatment options, to be honest, like what is available in the West, still it's not available in India.
In India, are women more open to talk with their partners about the menopause? And do you think men and women going through the menopause have a good understanding? Do men have a good understanding of what the women are actually going through?
To be honest, like women still feel like very difficult to find and talk with their partners, because sometimes even if they talk to the partners and they see like, okay, we don't need to go to the doctor, like it will just wean off on its own. And especially with the women as well, sometimes it's very hard for them to explain them. Or men, as you know, like thing is they only understand if they are aware about the thing. Some of the men are even not aware what does menopause means. They mean, okay, it's just like they are over with the fertile period, so thing is they can't conceive, but they does not know like what more it does have, like how does it affect the woman body. So I think so we need to educate men as well, especially in India. It's more of like a patriarchal society, but still men are improving. Like, to be honest, I've seen at my home as well. I talk to my dad, like my mom is like having a lot of issues, just help her out. So he understand that, and now he has also improved. So I think so this kind of encouragement we could do.
Slowly but surely things are changing for the better, but we just need to have more of it. That's what I feel in the UK. And maybe in India, would you say the same?
Yes, I agree with that. To be honest, like there's a gap, like especially in India, I feel say there's a significant gap, but still we are trying to like just like uh, overcome that gap, but still more needs to be done, especially in India, because we have a lot of variations, like culture variations, demographic variations, socio-economic variations. So we have to just like cover all the things. So
well, I have to say, I think you're absolutely amazing. And I really think what you're doing is fantastic. You're being so open to discuss a topic that I think even in India, you're saying there's still a big, taboo around the subject. Even in the UK, I think, we need more of this, more men like yourself that, gives all us women that encouragement that it's fine. It's just another phase in our lives. But if we have the right information and help, which you're doing, I think is absolutely amazing.
to be honest, like I'm thankful to you, especially the way you talk and you come up, and also like how you interact. Especially, it just gives women the encouragement. This is something they can talk about. They can ask for help, because it is not a bad thing to ask for the help, because men, as you all know, they have a little understanding. But if you explain things to them, they do understand, and then they do sympathize with you. So we can work on that. So thank you so much.
Oh, well, thank you. And honestly, Dr. Nav, I need to come to India. Me and you need to get together.
Sure.
And we need to be the voice behind this menopause to make women feel that it's fine. And thank you for being absolutely amazing. I've loved speaking to you.
Seema, ma'am, thank you so much. Thank you.
Thank you. Bye.